An ingrown toenail is where the nail, usually of the big toe, can happen on any of the toes, but most often it's the big toe. The nail can grow around and start to grow into the skin, and in response to that, the skin can become red, swollen, or infected and quite painful. There are a few risk factors that can increase your chance of getting an ingrown toenail. The biggest one is incorrect cutting technique. So that's where people will often try and cut down the side of their nail and curve their nail edge downwards, which can increase the chance of you leaving a little edge down there that as the nail grows will catch on the skin and start to grow in. So you're better off just cutting the nail fairly straight across and leave those corners untouched. Other risk factors include tight fitting shoes or pointy toed shoes. One I see a lot of is soccer boots or footy boots. They just tend to be pretty narrow in the toe and pretty tight fitting. It occurs a lot in people who have quite sweaty feet. A lot of teenagers tend to have quite sweaty feet. The softness, the sweaty feet causes the skin to become quite soft, and that can encourage a nail to grow in. Changes in nail shape, maybe from a fungal infection, maybe from trauma. If you've had your toe stood on and it's traumatized the nail bed, the nail can start to grow a little thicker and maybe a little curved, and that can cause, that can increase your chance of getting an ingrown toenail as well. We treat an ingrown toenail by taking out the edge of the nail that's causing the problem. It depends on how severe the problem is as to how much of the edge we might take out. So if you look at my beautiful drawing of a toe here, sometimes, let's say someone comes in and it's just a little spot here where the nail's got maybe a little spike, or the nail's just growing into the skin in this area. This one probably wouldn't cause all that much inflammation or swelling around here, but it might be quite sore. So what we would do with this one is I would think I'd be able to get that one out without too much pain or discomfort. So I'd probably just cut the nail straight down through here and take that nail edge out, and that would probably be enough for this person's pain to be relieved, and the ingrown toenail should settle down within a couple of days. If the ingrown edge is a little bit further down the nail, maybe down around here, that's a little bit harder to get out without causing pain. So in this case, I'd probably recommend that the patient have a local anesthetic. And that's just we use a really tiny needle. We give a little needle down here and down in here on both sides of the toe in the fleshy part. And that will make the whole toe numb, and then we can do a really good job of getting this out. And what we'll do, I'll just get rid of these lines here. So our ingrown toenail is sort of down in there. What we do in this case is, because the patient won't be able to feel it, we can take a bigger edge and come straight down there, and all of this edge of nail gets removed. We'll dress it up nicely with some antiseptic and a sterile dressing, and that should be settling down within a couple of days. So yeah, generally we'll discuss all of this when you come in, and we'll talk about whether we need to give you a local anesthetic or not, and all that sort of thing. But generally local anesthetics are pretty comfortable and don't hurt all that much.